Welcome to the Alberta Health Services video series on helping you feel better after COVID-19. This session will cover tips for getting started with activity and exercise. When you're ready to get started, you may need to start with much shorter sessions, especially if you notice an increase in symptoms with exertion. It's better to plan for shorter sessions more frequently throughout the day and maintaining a steady energy level than try to fit exercise all in at once and having to spend the day or next several days on the couch recovering. Pay attention to your symptoms and slowly build up the amount of time that you can manage. This may be in small increases, such as an extra 30 seconds or 1 minute of activity each session. Think about when you're likely to have the most energy throughout the day and plan to exercise then. You may need to start with breathing exercises and relaxation exercises, which help to decrease stress before you're ready to do exercise that increases your heart rate or breathlessness. Once your symptoms are stable or have passed, or you've been given the go-ahead from your doctor, you may gradually resume exercise. Be realistic about what is possible. Don't expect to start back at exercise where you left off before you got sick. Acknowledge that traditional exercise may not be possible right now. Monitor your symptoms, and depending how you're affected, stop exercise or scale back on duration, repetitions, or intensity if they're getting worse. If you have not exercised previously or are struggling to incorporate exercise, seek advice from a health or exercise professional and ask a family or family member for support. Physical activity is generally good for everyone, and too much rest can make joint and muscle problems worse. However, be aware that exercise is also a type of stress that can bring on other symptoms like brain fog, fatigue, or breathlessness. You can gradually increase the amount of movement in the following ways. Start to move more throughout your day. Aim to gradually return to your usual routine by starting with the easier activities like chores and short walks, and then slowly introduce the more physical ones. Monitor your symptoms and scale back on your activity if they are getting worse. Pace yourself. It's important to aim for a balance between activity and rest. At first, you may have to rest more frequently. Realize it may take longer to do things like getting ready in the morning, as you may need to rest after having a shower, again after getting dressed, and again after making breakfast. If you're still struggling with these basic tasks, like getting dressed or having a shower, it may be too early to add strengthening or cardiovascular exercises. People recovering from COVID-19 find that exercising too hard can make them very tired or make them feel worse. Approach exercise very gradually and with caution. Speak with your primary care provider, physiotherapist, or occupational therapist for further advice. All athletes and people that engage in exercise that test positive for COVID-19, regardless of their symptoms, must rest for a minimum of 10 days. The immune and inflammatory response to COVID-19 is lower in asymptomatic individuals compared to those with symptoms. However, it's still best to err on the side of caution and take it easy until you fully recover, or in the event that you have a delayed reaction to the virus and show symptoms later than usual. Exercise should not resume if you have a persistent fever, shortness of breath at rest, cough, chest pain, or palpitations. Any COVID-19 patient with an underlying cardiovascular or pulmonary condition should consult a physician prior to resuming exercise, even if you're asymptomatic. Start low and go slow. The best things to do are low impact. Think about things like walking, yoga, or easy cycling. If you prefer strength training, use your body weight or the lightest weight possible and build up from there. Don't pick up where you left off weight-wise before you got sick. Always do a light warm-up prior to exercise and assess how you're feeling before continuing to move on to more strenuous movements. Factor in time to rest after exercise, as fatigue may develop in the days following exercise, especially at the beginning. Ensure the exercise you choose is not worsening your symptoms. You may need to consult an expert to adapt or modify your exercises. Don't push through pain. Track your pain levels when getting started and monitor after exercise to see if there is a delayed effect. If the pain worsens after exercise, then cut back on the amount or intensity next time. If you don't feel recovered from the previous session, try gentle stretches or range of motion exercises instead. You might plan lighter activities in between more strenuous days. Plan for breaks during exercise and pace yourself.